Welcome to the TMI Doctor, talking all things TMI and health and wellness. Here's a highlight from today's episode. I say, can you carve out like 10 minutes a day to take care of yourself? And the
Mm-hmm.
number of women that just say, oh, I can't. Like,
Mm,
and you're just like, oh my gosh, 10 minutes? Like, you don't have any
yeah.
sports?
Yeah.
Yeah.
Yeah. Yeah. But
So,
I think, and this is kind of like where we might get into the deeper layers of what this even implies is that oftentimes we don't feel worthy of receiving those 10 minutes a day.
yeah.
And it's because of conditioning and all these like multi layers of like you always have to be in a place of servitude.
Yeah.
But there's so many studies out there that show that when we're constantly in this position of serving others and not serving ourselves as well, which that should be number one,
Yeah.
that our libido plummets within the first 4 years of being in a domestic situation, like a more, you move in with a partner or you have children with a partner and you're just, there's so much, right? There's so much.
So, hi everyone. I'm the TMI doctor, aka Dr. Tanya Yannick, pelvic health specialist, talking about pee, poop, and sex all day, every day. I'm here
Yes.
with Alexandra Espino. Did I say that correctly?
Yes, you did. You did good.
Awesome. She is a somatic sex coach. She is the co-host of the podcast, The Reclamation Hour, which I've become a fan of recently. And almost every episode, I am like emphatically like nodding my head, like, yes, 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 like we need to talk about this more. Because, health and wellness is mind, body, and spirit. And I think we're mostly disconnected from all three of those at this point.
Yeah. Yeah.
Like all three. Like we think
All
we're
of them.
doing it, but like it's not in a healthy way if we are in some ways. So discovering that path and helping others discover that path. And I love to bring on people that complement pelvic PT and somatic sex coaching. Seems to fit that bill. I actually am learning about it myself, so that's why I have Alexandra on here, telling us more about that. So yeah, tell us more about what you do and
Mhm.
like how did you get into it? Like what was is it a short journey, long journey?
No, it was actually very long.
Oh, was it? Okay.
It was so long.
Most of
So,
our journeys are long. Yeah.
yeah. But I think something that happens with a lot of us who are in this field is that we get into it through our own healing journey,
hmm
which seems to be the common thread. But that's basically how my journey started is through my own healing from sexual trauma and abuse and a few other big T traumas that were definitely affecting my sexual expression and my ability to feel pleasure. So that's kind of how I got started.
Yeah.
Short and sweet. Let's keep it short and sweet.
Yeah. Great.
Mm-hmm.
Yeah, and I see that a lot in my office, unfortunately. And
Yeah.
just to touch on what I learned from Cassie McCarthy, she's also on this channel.
Mm-hmm.
We talk about big T and little T, and obviously big T is a huge thing.
Mm-hmm.
But like the personal versus impersonal, like I think we just what I wasn't, I was like, I had women even say this to me, like, I have a good childhood. Like, I don't know why I'm having all these issues. But it's the constant personal stuff that we're dealing with the day to day. And that's what,
Yeah.
the podcast that you're on talks a lot about. Like,
Mm-hmm.
that's why it was just like, it was filling in these little blanks. And I was just like, where is this coming from? And why do we feel like we have to be perfectionists? And why
Yeah.
are we not having boundaries? And you're like, oh, it's a systemic issue.
Yeah. It's a whole
Under
shit. Yes.
all day long. And I'm like, yes, yes, this is what's been happening. So
Yeah.
so yeah, that's when I'm in my car listening to your podcast, like
Oh,
screaming.
I love that.
Like,
Thank you, Tanya.
but it is a journey. Not everyone's
Yeah.
there yet. Usually people are coming in saying like they're deep in the, I gotta do the work and I have the kids, and I
Hmm.
gotta be a good wife, mother, daughter, sister,
Yeah.
doing all the things. And they're like, okay, I have no libido, I have no libido, sex hurts,
Yes.
all these things are going on, and give me the stretches that are gonna fix it. And I'm like, oh boy, there's
There's so much there.
unpack there. It's even if the ones that are like, yeah, I don't have trauma, but like, clearly something's just wrong that I need to fix.
Right.
And I'm like,
Right.
And in some cases, there are just simple, easy things I can
Yeah.
teach them, but sometimes it is, I say, can you carve out like 10 minutes a day to take care of yourself? And the
Mm-hmm.
number of women that just say, "Oh, I can't." Like,
Mm.
and you're just like, "Oh my gosh, 10 minutes? Like, you don't have it
Yeah.
in sports?"
Yeah.
Yeah.
Yeah. Yeah. But I think, and this is kind of like where we might get into the deeper layers of what this even implies is that oftentimes we don't feel worthy of receiving those 10 minutes a day.
Yeah.
And it's because of conditioning and all these like multi layers of like you always have to be in a place of servitude.
Yeah.
But there's so many studies out there that show that when we're constantly in this position of serving others and not serving ourselves as well, which that should be number one,
Yeah.
that our libido plummets within the first 4 years of being in a domestic situation, like a more, you move in with a partner or you have children with a partner and you're just, there's so much, right? There's so much. Yeah.
So with somatic sex coaching, can you give like the
Mm-hmm.
elevator pitch of like what is that? Because that is
Yeah.
like what is somatic? Like I know, but
Yeah.
well,
Yeah.
and even to a certain degree, there might be things that I don't even actually know what is involved. But I know
Yeah.
it's integrating movement and embodiment is how I see it. I don't, maybe that's totally
Mm-hmm.
wrong, but
Yeah.
um,
No, it's
yeah.
good. Yeah. So somatic sex coaching is a more body-based approach, a trauma-informed support that helps people reconnect with their pleasure, their self-worth, their confidence, their self-esteem, and it helps release shame or any conditioning around that because we live in a culture where male pleasure is what's centered. And so there's a lot of that comes up obviously, and it's being stored, it's being stored in the body. And so the goal of somatic sex coaching is to build nervous system safety, so and resilience around intimacy, erotic expression. So it's very nervous system led, and we focus less on dialogue and talking and more on feeling, sensing, um, and also forming new neural pathways that help us build um, better or healthier um, movements, so that we're training the fascia. Basically we're retraining the fascia to have a better, healthier fluidity and momentum and all of that, because that also matters. A very healthy fascia is one that, whew, that's a whole nother thing actually. Let me
Yeah.
not get into that, but that's kind of the elevator pitch. So
Yeah.
yeah, it's very much about sensing, it's about feeling, it's about reclaiming the body's wisdom and integrating it. So it's a more holistic way of approaching what traditional sex coaching does.
Mhm.
Yeah, and it's more trauma informed for sure.
Great. Yeah, I have the number of times I've heard women say, first they say they don't enjoy sex or it's
Oh
painful.
yeah.
And then
Mm-hmm.
I ask them, have you told your partner? And the number, it breaks my heart that say no,
Mm-hmm.
because I feel bad for him. I
Mm-hmm.
feel like there's some sort of guilt or shame around saying no to him.
Yeah.
But the irony is that they're just building up that nervous system, like it stops trusting you. Like you're
Yes.
betraying your nervous system over and over and over again. It's saying
Mm-hmm.
stop and you're still going. So it's like I even have that conversation of like I give them a date night menu. Like sit down and
Mm.
think of all the things that you are excited and happy to do, even if that just means like holding hands and massage.
Mm-hmm. Yep.
That's
That's
it.
intimacy too.
It's still into like
Yeah.
any sort of touch or sensuality that is with your partner. I'm like,
Mm-hmm.
have a yes list, have a maybe if only if you initiate, and have a things that like every time you think about it, you're just like anxious about. And I'm like,
Yeah.
it's on, and then have it just like throw me under the bus. Say, my doctor said I'm not allowed to do anything unless it's on the yes list.
Yes.
I'm not going to meet, like, I might meet this partner, but I'm fine saying, like, yeah, we don't do anything unless she
Absolutely.
is 100% okay with like moving forward with it.
Mm-hmm. Mm-hmm.
Which seems like common sense, but like, again, back to the
Mm-hmm.
conditioning of like, we're taught to self-betray. We're taught to
Yep.
like smile and be accommodating, even if it's uncomfortable for us.
Yes.
And that is so insane. Like, and it's so obvious, like it's in plain sight.
Yeah.
And then when you say it out loud, you're like, that's insane. And then we're like, oh my gosh, that's even, you see it and hear it. Like once you see it, you can't unsee it anymore. And you just
Yeah.
face
Yeah.
it is everywhere. And
Yeah.
So yeah, getting women to be like, no, it's okay to say no. And like so many are like, I feel bad. They're gonna feel rejected. They're gonna like
Mm-hmm.
that. I'm like, no, 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 no. Like that's that inner body wisdom that when
Yes.
you feel that tightening in your gut, they don't even know what that feels like. And I'm like, does that feel good? And they're
Mm.
like, no. And I'm like, that is your body's way of saying no. And they're like,
Mm-hmm.
oh.
Yeah,
And I'm like,
absolutely.
if you're starting to feel tense, if you're starting to feel
Mm-hmm.
dread, that is your that intuition.
Mm-hmm.
Um, because then they're trying to logically battle it and say
Yep.
things like,
Mm-hmm.
but he loves me, but I'm
I
a
see
good
that a
wife.
lot.
And I'm like, ah, like two things can be true. You could be like, this made me
Yes.
feel good, but also he is a good partner that I want to please.
Mm-hmm.
But like, meet in the middle somewhere, people.
Yeah, absolutely. That's very possible. You're so right. I love that.
So, you don't have to give away all your secrets or anything, but what, like, if someone were to work with you, is it like a lot of like, we're just going to get on a mat and move around? Is it sometimes,
Um,
writing, expressive writing? Is it something in between? Is it, I know
yeah.
you talk about shadow work and like kind of digging
Mhm.
into like where the root of some of the issues are.
Yeah.
And that's like, where is there therapy versus coaching? Because I know that's always I always have to walk that line because I'm like, okay, we're starting to wade into therapy waters. We need to refer
Yeah.
you out to mental health or
Hmm.
other types of therapy. But
Hmm.
um, like kind of an overview, if you could give like an outline of kind of what working with you looks like, so
Yeah.
people know what am I getting myself into?
And what is a coach essentially, right?
Yeah.
Um, so yeah, there's like a lot of overlap there, but usually, so the clients, let me start with saying that most of the clients that I work with are women who have experienced some sort of disconnection from um, their sexual expression, whether that's through trauma, shame, religious conditioning, or
Hmm.
just not feeling safe in their bodies where they have uh, chronic long-term unresolved stress and they don't really know how to pull away from that loop or close that loop. And so there's a lot of nervous system dysregulation, right? And this could also be what's considered like little T trauma, where you're just in a constant set of stress, even though it's like
Hmm.
nothing that's like huge. But if you have high cortisol levels,
Yeah.
it's going to impact your fascia, your sexual drive, all of that, right? And so what we do, I usually meet them where they're at and just depending on where they're at, because there are a lot of modalities that I use to
Okay.
be. So sometimes I'll use hypnosis. Sometimes I'll use erotic hypnosis, which is a whole different thing. Not a whole different thing, but it's obviously more erotic.
Hmm.
Sometimes we use somatic shibari as a way to connect with the body and boundaries and sensations and your yeses and your nos. Sometimes we do use IFS parts work
What
therapy.
is that?
So it's a modality where basically you see someone as, we have all these parts within us, right? Where like each
Hmm.
parts have like sub personalities. And so oftentimes there's like a polarization there, or like these are what are basically known as like the blocks. Like what's the emotional block under that? And then you're able to introduce safety, presence that, and it's basically it actually was the creator of that system, that modality was Richard Schwartz.
Hmm.
So if you wanted to look into what exactly it is, definitely look up Richard Schwartz. I think it's a very, very good healing modality, especially for trauma survivors. Um, and most of us who tend to live in our minds and love to intellectualize things, where then we're kind of our attention, our awareness is being brought into the body and the sensations that these different emotional parts of us are kind of at battle with. So sometimes we'll do IFS parts work, sometimes we'll do somatic experiencing, sometimes we'll do somatic exercises. So it's like repetitive movements and gentle exercises to get the vagus nerve to get that stimulated, to get you back into ventral vagal, so there's a lot, right? And then to also basically floss the fascia. So yeah, there are a lot of things that we use, and it just depends on where the client is at, what their goal is,
Hmm.
and yeah, does that answer your question? I know that was a
Oh
lot.
yeah, yeah. It's just I always like to simplify it, even if I know what the answer is, because
Hmm.
it's easy to like, we talk about this all day, but if
Yeah,
someone is just like, the average person that knows nothing about body, mind, spirit
exactly.
stuff, and then they're just kind of like asking, like, how do
Hmm.
I, just like that person that walks into my clinic that's like, how do give me that stretch that or that exercise that's
Yes.
just going to fix my sex life, and you're like, well, this is going to be a little bit more involved than that.
Yeah, it
And what
is.
does that mean? Because then
Hmm.
they're afraid. They're like, what is this? Like, where does they kind of want to know what they're getting into. Like, doesn't mean because then they're like, am I coming in for stretches? Am I getting massage? Am I moving
Hmm.
around? Am I dancing? Am I
Hmm.
which I even tell my patients, like, literally shake it off. Like, you don't have to.
Yeah, it doesn't have to be fancy or
Yeah,
anything like super elaborate. It depends, depends on where they're at.
yeah, that's great. Awesome.
Yeah.
Um, what are things you wish people knew more about as far as what you do? Like, is there or a common misconception? Do you hear something
Oh
that's
my gosh. Yeah. There's a lot of these,
there's
right?
something you repetitively hear that you're like, it's always when they talk to me, they thought it meant this, or oh
Yeah.
gosh, I wish people knew more about
Yeah.
XYZ with your.
I think the thing that a lot of, but I see it more so coming from cis males is that, oh, she just teaches people how to have sex.
Mm-hmm.
And
No.
I'm like, well, no. Or like she teaches women how to be better at sex when it's like, no, actually, I mean, that's kind of a byproduct of that. Like you do definitely get better orgasms, like better, higher quality orgasms, but that's not the focus. And it's definitely not male pleasure focused.
Exactly.
So there's so much, right? There's so much that goes into it's not me literally watching people have sex and like coaching them through that. That's
Yeah,
not what
yeah.
that is. So I think that's probably the most common misconception that
Mm-hmm.
people have about sex coaches. Um, I think that's the biggest one that I've heard at least in the last year or so. And I'm like,
Yeah.
okay, I'm kind of getting tired of answering this question.
Yeah. No, that makes sense. Yeah. And that's why
Yeah.
I asked the question, because you're just like, oh, can I get this message out that no,
Yes, like
it,
get this message
stop
out there,
it.
please, because yeah, that just and people are, it's kind of silly like their reaction when you do say like, especially because I have three little girls. And so whenever I take them to like birthday parties or whatever, I know their parents are like asking me, like, oh, what do you do for work? And I'm like, oh,
Oh, that's a fun
it's a
conversation.
weird job, but somebody's gonna do it, right?
Yeah. Oh, that's
But
great.
it's really not weird. It really is,
No,
it's not weird. It's just people
everyone's
think
doing it, literally.
yeah, literally you have children like you're doing it.
Yeah.
But yeah, that's like the biggest. They're like, wait a minute, what does that mean? Like, does that mean that
Yeah.
you're just watching people have sex and like coach? I'm like, nope, not at all.
No, no, it's empowering the person that's trying to experience the sex. Yeah.
Exactly.
Yeah.
Exactly. Yeah.
Yeah. It's like pelvic PT. They're like, oh, I didn't think I need pelvic PT because I've been doing Kegels. And I'm like, oh,
No, 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 no. That's
and
like
half
the
the time,
worst.
yeah. And then half the time it's not even what they needed, especially if they have pelvic pain. And
Oh,
it's coming
yeah.
from doctors. Doctors are like, oh, something's wrong with
Yes.
your pelvic floor, do Kegels. And I'm like, not when you have pain. That's like,
No.
yeah, I have a muscle spasm, so let's like, do more, make it
Yeah.
act more when it's spasming. Yeah, that makes sense.
Yeah. I have a lot of clients who have wow, why am I blanking out? Because I was reading on
Vaginismus.
vulva. Yeah, I was reading about vulval. It was what is it called? Vulvodynia, but it's
Yeah,
not, it wasn't that. I don't think I've had anyone who's had that diagnosis, but I do get a lot of people who have vaginismus
yeah.
and or other things that just a very hyper active pelvic floor. And yes, the amount of people that like when obviously we have to assess like what's been going on so far, like have you gone to see an OB, like what kind of establish the baseline of where they're at. And most of them say, well, my OB just told me to do Kegels and that should resolve. And I'm like, you are literally spasming, like your fascia is already so tight. Like that's the worst thing that you could do for yourself.
I'm just like, well, at least they know we exist now, but like, yeah, like, but even then, they're just saying just do Kegels, don't see us.
Yeah.
So it's
Mm-hmm.
like, oh, you
Mm-hmm.
don't need to see them, just do. That's all they do, and I'm just like, no, like,
Yeah.
that is like a
No.
that's like maybe day one, I'm just checking like, is it tight? Is it weak? Do you need to do
Yes.
Kegels? And then I'm off to the races with everything else I'm teaching them. So like it's like step one of like 100 of things I can
Oh
go.
my gosh. Yeah.
Oh my
Yeah.
God.
And
That's
then I
insane.
think postpartum too. I mean, the amount of women who are basically dismissed for still having painful sex at post they're like 6 weeks, that's like when they're done, right, with their post, but that's not true at all. Like there's so much support that needs to be given still. And so yeah, just the fact that that's normalized
Mhm.
is not okay.
No, it is not. And it's amazing because I think a lot of women fear, like, the muscles were stretched and all that. So you
Yeah.
gotta do a million Kegels. So they overdo it. But our bodies are
Mm-hmm.
really good and resilient, and it does, heal and, I don't wanna say correct itself, but like it does come back. And like the number of women that I've treated that they were like, oh, well, it hurts, but I'm not having any other symptoms. And I check them. I'm like,
Yeah.
yeah, you've like your body is
Mm-hmm.
like way overcorrected.
Yes.
Like I can barely get my finger in there. Like
Yep.
stop
Yep.
doing Kegels. Like if your bicep
Yes.
hurt, you wouldn't do a bunch of bicep curls with it. Like so why are we
Exactly. Exactly.
it's
But
just a muscle.
that just also goes to show like how much we lack. There's that like education gap between sexes, right? There's so much. There's
Yeah.
so much.
And then they're told like just have a glass of wine or just relax. I'm like,
Oh yeah, that is probably one of the worst answers that I hear, when that women get.
mm-hmm.
It's like, "Oh, well, if you can't relax, just have a glass of wine." And it's like, "Nope, nope,
Yeah.
no,
Yeah.
no, no."
Let's not do that. Yeah. All right. I'm trying to think if there's anything else that's um so if I were to come to you as a somatic sex coach student or client, um I'm assuming you ask a lot of questions about
I
like where
do.
it came from and yeah, so
Hmm.
like kind of diving into that, so getting that background, then figuring
Hmm.
out like what that person needs is do
Yes.
they need movement, do they need fascial, retraining essentially.
Yeah. Yeah.
Can you touch on that? You said like, oh, I can go into a whole thing, but can you maybe also try to, I know it's probably
Yeah.
super hard to
Yeah.
keep it, we can
Yeah.
all write dissertations on every topic we talk about, but
Right. That's the thing is
it's so
and it's so
hard.
juicy. And I feel like we're both pretty nerdy about this.
Yes.
You know what I'm saying? So yeah. No, but so kind of like what you were saying is, retraining the fascia, right? It's important to retrain the fascia because especially for example, with someone who has a lot of pelvic floor tension,
Mhm.
the fascia, which is the connective tissue that is basically like the glue that holds everything together.
Yeah.
This is where it's highly innervated, but it's also where we store a lot of unprocessed trauma, a lot of repressed emotions, things like that, right? And so, what happens, for example, someone who has experienced a lot of trauma, emotional trauma, what happens is that we tend to have really shitty posture,
Yeah.
right? And
We're
it's
just
one of
pulled
those things.
forward.
Yes, we pull forward, our shoulders roll forward, kind of like as a way to protect the heart space.
Mhm.
And so when someone, says like, "Oh, we'll go see a chiropractor and go do body work," this is all helpful stuff, right?
Mhm.
But it provides a very temporary sense of relief because we have something that's called sensory motor amnesia. And so this is a term in somatics where this was developed by Thomas Hanna. And so it refers to the phenomenon basically where the brain forgets how to sense and control certain muscles, usually due to chronic tension, trauma, repetitive stress. So even after body work or a good release without re education or
Mhm.
conscious repatterning of the fascia, the body will often revert back to like the familiar holding patterns. And so because basically the brain hasn't yet relearned this new way of being, like we haven't rewired these neural pathways. And so that's kind of like what the somatic gentle exercises are for, is to repattern like retrain the fascia and then repattern our holding, the ways that we hold our holding patterns.
Mhm.
And in doing that, we we tend to create more healthier movements, but also healthier habits that are stimulating the vagus nerve that keep us in a rest and digest mode, as opposed to a fight or flight response, freeze fawn, all of that. So is body work absolutely helpful? Absolutely. Like definitely. I love CST. I love getting cracked like a glow stick. I love all the things. But it's definitely, I think it has to be like a co-effort of also retraining the fascia, because that's really where all our memories are stored somatically. Does that, do you
Oh
think
yeah.
that that's okay? I'm
I
like,
mean,
how much more do you want to get into this?
no, I just like if there's any words that are kind of jargony, I try to like just dive deeper just so our audience knows.
Yeah. Yeah.
Because
Yeah,
it's you to like be
absolutely.
like, yeah, of course, somatics, and someone's like, what is this word you keep on using? I don't know the name.
Yeah.
Like,
Yeah.
well, like the, that's the whole point is just because people are really still at that very base, like very
Yeah.
you
It's
know,
definitely a more
level.
modern concept,
Yeah.
or
But
unfortunately, but
it is there is a lot of overlap with what I do, but there are
yeah.
also a lot of PTs. There's not a lot of pelvic PTs, and of the ones
Mhm.
though, there's a lot that are just kind of getting thrown in. They take a weekend course and then they're off to the races at the clinic, which is good. I mean,
Okay.
we all got to start somewhere.
Yeah.
Um, but I'm finding a lot like, I used to get intimidated if I saw someone that had already seen a pelvic PT, like, oh, you've already seen someone. I don't like, what am I going to help
Mm,
with? Like, you've already done it. And then 90% of the time, they've done a fraction of what I do with the patient
yeah.
because they're bringing them in. They're just like, do a vaginal assessment. Okay, I guess release some muscles or make them do Kegels and maybe a couple other exercises and stretches, and then they're good. And
Mm-hmm.
I'm like,
Mm-hmm.
but what about retraining their hydration habits? Asking what they're
Yes.
eating, like how are they moving? How often
Mm-hmm.
are they moving? What are they
Mm-hmm.
doing? What is their state when they're, because I have people that are like exercise maniacs that are a mess because it's
Mm,
all under the I have to be skinny and I have to be this and I have to be that, I
mm-hmm.
have to be perfect and I have to hit these times with my race or like, and it's just this like there's no enjoyment or embodiment. It's just like
Yes.
stay to
Go,
the
go, go.
schedule. And I
Mm-hmm.
have people with pelvic pain with that because again, they think they're being healthy, which they are I mean, obviously their cardiovascular and muscular health is
Right.
great, but integrating that with the mind, body, sexuality, like all of those things, it's just like not connecting at all.
Yeah.
So just like a lot of it is like, it's so funny because they'll ask me, well, how many reps do I do? And I was like, well, this isn't they're thinking of it like, okay, if I do 10 reps of this, three
Mm-hmm.
times a day, like I'm gonna get better. And I'm like, but somatics isn't like,
No.
checking in with your posture
Yeah.
and are you taking a deep breath every once in a while? Like
Yes.
diaphragmatic breath opens up the
Mm-hmm.
pelvic floor just naturally. And
Mm-hmm.
are you doing it? Everyone's good at the deep part, but not the slow part. Cause I remember, I forget when and where you said it, but you said something like breath work can be dangerous for some people because they basically
Right.
hyperventilate because they don't know how to
Yeah.
do diaphragmatic breath.
Yeah. Yeah.
Because
Yeah.
and I'm like, that is a good way to hyperventilate. Let's not like
Yes.
do a big huffy in out in 2 seconds. Like that, you do that a bunch of
Yeah.
times, you're gonna get lightheaded or get
Yeah.
yourself, upregulated and not
Mm-hmm.
downregulated. And
Mm-hmm.
so I always say, take a nice long deep breath in so you can't even hear your own breath. And they're like, what?
Exactly.
How does that work?
What is it? Yeah, that's the thing,
And
is like the general population, we don't know how to breathe
no,
properly.
not at all.
So, especially too, I think in your case, when you see a lot of postpartum women, that's something that's probably why you're like, well, how's your breathing? Because we tend to breathe way differently
Hmm.
when we're so pregnant
Yep.
than, when we don't have all that weight and all that pressure on our organs. And it's like we are having to like retrain ourselves to breathe actually deeply and from the diaphragm
Yep.
and all of that. So I love that you pay attention to that, because that, man,
Huge.
pelvic PTs are like angels. They really are. I loved mine when I was going through my experience,
Yeah.
because you guys really do look at all of it. And
Mhm.
I had no clue that, kind of like what you said, where, they basically take like a week of courses or whatever, and then they just
Yeah.
get thrown, which is great. But I think, I mean, and at least in my experience, I've had nothing but great pelvic PTs and occupational therapists too. And holy, like that's just so complementary. Like both of our
Yeah.
fields are so like so good together, I think. Yeah.
Yeah.
And most of my clients also work with pelvic floor specialists as well for that reason. So
That's awesome. Yeah.
I love that.
Yeah, and especially with pregnancy, like that deep core muscle is what gets stretched. So of course, a lot of the, the muscles we need to breathe are like super compromised. It's,
Yeah.
we don't think of pregnancy as an injury, but it's a bunch of strains and sprains. Like
Yep.
it just is. Like even if it's natural and normal, things got strained and sprained in the process. And
Yeah.
those messengers in our muscles that tell our body where we are in space or how to function are
Mm-hmm.
damaged in that process.
Mm-hmm.
And just like if we sprain an ankle, we go rehab it. Like, but the
Yes.
maternal care in the US is horrific. Like in
Horrible.
France, you get your 6 week OB appointment and you go to PT. Like
Mm-hmm.
every single woman. And they do
Mm-hmm.
not have the issues we do. And I'm like, occasionally I'll get that referral from an OB saying like the patient saying like, well, my OB said like I should probably just get checked out afterwards just in case. I'm like, thank
Oh,
you. Like
goodness. That's good.
starting to get there, but
Mm-hmm.
but it should be just maternal care. Like everyone gets a PT
Yes.
assessment, like just to make sure everything's up and ready to go, and have these discussions of like, no, just because it's 6 weeks doesn't mean like you should be pain free with sex
Right.
immediately and back to the races. Like no,
Mm-hmm.
like your immediate acute like tissue damage is healed, but like there's still a lot going on,
A
especially if
lot.
the new moms or the second child. Like it's such a huge you talk about that on the podcast, how that's like a rite of passage and you have to almost like grieve your prior life and self. And
Mm-hmm.
like they're just like, yeah, just you're fine. Go enjoy your baby. Like you're fine. I'm like,
Yeah.
oh
Yeah.
no, this was a major situation. We're just like glossing over it.
Yeah. And I mean that is as natural as birth is. It's still a traumatic experience for the body. It's like one of the reasons why we get those post-birth shakes where we're just
Oh, I
like
didn't know about that.
tremoring. Oh my gosh, I could not. I could not calm myself, but it's one of the ways in which our bodies are trying to like get rid of all that extra, all those stress
Mhm.
hormones that and the contractions that were built during the time of transition or really the entire process of birth. But yeah, it's a big thing. Like
Mhm.
let's not minimize how big and brilliant and just it's a whole different portal that you step into.
Yeah.
And it's not just a body experience, it's a mind experience, it's a spirit experience, it's all of it.
And it's interesting you mentioned the shaking because that is something I've witnessed, and it's not something they tell us about it in our courses
Yeah.
or in school. Like the number of times I've seen women, their legs or their hips start shaking, they'll
Shaking.
get emotional afterwards.
Yeah.
I'll even apologize, like, I'm so sorry, I have no idea. I'm like, don't question it. We're just something
Yes.
needed to release. Like
Yep.
we're doing stretches and stuff, and they'll start to shake and they'll get weepy or teary or like just
Mm-hmm.
outright cry. Like I'm like, we don't need to know why. Like your body needed to release it. We are releasing
Yep.
it. We are moving the muscles and the fascia and
Mm-hmm.
all that. Like it's letting something go, just let it go. Like there's no
Yeah.
judgment here. So and sometimes like if you need to rock, if you need to move, like
Mm-hmm.
I think that's where I started learning like, okay, I've noticed people do better if they can rock or move because a lot of
Mm-hmm.
people holding this tension I hear the constant like, well, I'm not good at meditating because I'm not good at sitting still or clearing my mind. And
Right.
I'm like, that is, oh my God, that is not the point of meditation.
No, it's not.
Like at all.
It's
But
not.
that's what everyone pictures. Like, I have to be zen and not think about a thing and be absolutely still. And I'm sure for some
Mm-hmm.
people that works, but like I've learned like active meditation or like getting into a posture that like just your body is asking for
Mm-hmm.
like and usually it's a hip opener like pigeon pose
Yeah.
or happy baby or
Right.
child's pose or and then if you need to add a rocking or if you want to move into a different pose they're like oh that doesn't feel good
Mm-hmm.
anymore okay move into the next I'm not this isn't like you have to hold this and everyone
Yeah.
wants to do that checklist of the prescribed like
Mm-hmm.
this is the path to
To healing, and
it's
it
getting
becomes kind of
better.
a like a rat race or like a hamster wheel that you just can't get out, and at that
Yeah,
point it becomes, I think, more harmful than productive
yeah,
for that healing journey.
yeah,
Yeah.
totally true. Yeah.
Yeah.
And that's what I'm trying to get. So that's when I started. I did get my sex education and counseling. Like there's a certification that I went through with someone that has the ASECT certification. I
Oh
can't,
yeah. Yeah, yeah.
American Association of, yeah,
Yes.
Sex Education,
Sex
Counseling,
education.
Therapy.
Yes.
It's such a long.
So long, I know.
I am not certified in that, but I did take like a basically pelvic health specialist,
Okay.
like um, multi-month like course through that. It
Mm-hmm.
was super like it has definitely helped my practice so much because that's where I've been able to do like a little bit of the sex coaching and stuff. Like I don't do anything, wild, but I'm like, that's where I came up with like the date night menu and the date night routine.
Yeah.
Like, okay, it's not just about the stretches and exercises. It's
Hmm.
just like, I want you to look forward to spending time with your partner again.
Yeah.
So yeah, that's, we need more of that, but I can't do everything. I'd love to be a one-stop shop, but we're all
No,
just one
same,
person that can
same.
only learn so much.
But this is so good, right? Because this is kind of, you know, I mean, obviously I'm going to get back into probably like something that we've already covered on the podcast, but you know, back in pre-patriarchy and the temples, the sacred temples, like we had so many specialists and basically a priestess for everything, and everyone had their role. And if you needed a thing, then we would pass you off to the next priestess who specialized in that, and back and forth. And I feel like finally we're beginning to see that a little bit in modern
mm,
day society. So I think we're starting to be able to like connect the dots and have this more holistic way of looking at a client or a patient and then assessing them like in a more holistic as a whole
yeah,
rather than just like as a part of a thing. um
yeah,
and
definitely.
yeah, that's like the beauty of it is like we're not meant to know it all. We're not meant to. We're kind of meant to just have these, secure connections with other people who have a specialist, whatever knowledge and education background they have. I think that's very beautiful.
Yeah, that's the whole point of
Yeah.
having community. We can't do it all.
Yeah,
We need each other
exactly.
to get through it.
Yeah.
That's the whole
Yeah.
point. And we've lost that, and we need to get back to it.
We do.
Sounds delightful to. I'm like, how do we get back to having, community where, because I want to help more people, but I'm like, I also need to pay my bills, and I hate that. And
Yeah.
like, can we
Yes.
go back
Yeah.
to a barter system? Like,
Yeah. I get that. I
can I
get
live in a
that.
temple and be just taken care of, and then I can just take care of people?
Yes.
That would be great.
Right.
I
Yeah.
would
We
just be
need
like,
that.
just
Bring
come
the
see me.
temples back.
Yeah, we have skills. You put us in the temples, we're good to go. Like,
Exactly.
we'll take care of the whole community. That's great. All right. So I want to be respectful of your time. Thank you so much for coming on here. I want you to tell us where you're at, where we can find you, because I don't know if you do one-on-one things in person, versus
Yeah.
online. So online or in person, where they can find you.
So I'm just going to send you the link.
Okay.
I'm going to send you
Way
the
easier.
link.
Okay.
But basically, what I'm focused on doing right now in my own personal work is the one-to-one sex coaching. And so it's like a 3-month coaching container or a 6-month coaching container. And we basically work on a one-to-one scale. And if you're interested in that, I will send Tanya the link to book a discovery call where we kind of get to know each other and see if we're a good fit. And if I feel like we're 100% in alignment to work with each other, then we can go ahead and discuss other things, right? So that's what I'm focused on working personally at the moment. And then you can also find me as the co-host of the Reclamation Hour podcast, where we get into a lot of these juicy topics as well, which I will also send you the link, or I'm sure you have it already since you seem to be binge watching. Thank you.
Every Friday, I'm like,
Thank
when's
you.
the new?
Everybody,
Have they
oh,
posted
I
it yet?
love
They haven't posted
that.
it yet.
That's so cute. Oh my God. Thank you.
Yeah.
Um, and then Kate just also announced that I'll be part of the membership, her membership that's called the Temple. And so in this membership, we're also going to host workshops and things like that, where I'm also going to integrate some somatic stuff
Oh, cool.
and all of that. So we will be launching that more towards the end of this month, I think around the 26th, something like that. And of course, we can also leave you guys the link for that in the description. Yeah.
Perfect. Well, awesome. Thank you so much for coming on here. It's been awesome. So yeah, look into some somatic sex coaching if you need a little addition to your life there.
Yeah. Thank you so much for having me, Tanya. It was such an honor.
Great. Thank you so much.